various conditions. So when you come to see me, obviously it's initially the 50 minutes initial appointment in which I take detailed history. I go through what has been disturbing you recently and also look at if there have been any difficulties in the past. I go through your developmental history to make any connections if any developmental issues had any connections or implications for your current presentation. I explore your family history. I look at if genetically you are at increased risk of having psychiatric illnesses. So by completing all these detailed psychiatric assessment, and I also use certain validated rating scales or assessment tools to measure the severity of your symptoms. While doing the history and using these rating scales, I also do mental state examination, which helps me formulate my diagnosis. My diagnosis is based on the holistic approach, looking at biological, psychological, and social factors which have been affecting you. And then I formulate my treatment plan addressing all those three areas. So I'm not just a pill pusher. I look at, okay, if you do need treatment, I'll be the last person to recommend the medication, but I will try to help you move on in your life with least amount of medication as possible. While choosing medications, I will give you information. I'll provide you with the links of the websites which are reliable, scientific, and explain these in a very simple format. And once you make a decision, then it's a joint decision, joint responsibility, and I will walk with you during that treatment plan. I'll prescribe it for you, and then of course I will ensure that we meet again for a review appointment. Review appointments are normally for 30 minutes. At the review appointments, we go through how the medication has been working, has there been any side effects, do we need to adjust the dosages or do we need to change the medications. And as I mentioned that my treatment plan is holistic care, so I look at not only medication but also other interventions such as psychological interventions, whether be it in the form of counseling or any formal structured therapy such as CBT or EMDR or any other form of therapy. I do not provide therapy myself, but we have therapists here at Harley Therapy whom I can recommend. And I work with your psychotherapist to understand how you're progressing in your therapy as well. Sometimes we arrange joint reviews as well to make sure that you're getting the right amount of care. I also look at other things that may help you. It may be as simple as knowing your condition, how to manage it better yourself. It could be looking at developing some hobbies or interest beside your busy work schedules. That can help you gain more confidence. It can help you relax better. It can also help you deal with managing your situations. If you're struggling in any aspect of your life, I'll obviously try to help as much as I can. We can explore options. And of course, as I mentioned before, that I always work jointly in collaboration with my patients and their carers.